for the month of November 2021. I'm so excited to have everyone on the call this evening. You're highly welcome. I hope you all had a good day. As you come in, you could just introduce yourself and say where you're from, so that our speaker, that's our invited guests, will have an idea of who are in the house. So you could just introduce yourself by name and say what to do. I'm sure I know most of us, but it's good for our speaker to be able to engage with us as well. So it's a pleasure to have you here this evening. Thank you for following us keenly. Thank you for being part of our community. Okay, so we're going to be starting in a little bit. And I'm going to be introducing our speaker shortly. Let me just bring up our profile. Oh, yes. Okay. So yes, the link is on Telegram. Thank you, Ma. A lot of people have been asking me for the link, but I tried to broadcast it again for the benefit of other people who didn't see it. So please don't forget to introduce yourself as you come into the meeting room.
Yomita is my name.
Oh, hello, sir.
Good evening,
You're welcome, sir. A pleasure to have you here tonight.
Thank you.
Yes, sir. Okay, Jaye, EGP in the UK, you're welcome. So glad to have you, Jaye. Jaye is one of our associates at LCI. And we're going to be listening to her in about 2 weeks from now in a master class. Okay, Femi Bonola, you're welcome. Mrs. Lucy or Obayoana, you're welcome. Thank you for being here. Ebunoluwa Ayodele from the UK, thank you for being here. I just saw one of my mentors, Dr. Stephen Johanna, you're welcome, sir. Mr. Tunde Alabi from Nigeria, you're welcome, sir. Yeah, okay. So I think we are off to a start. Just give me 1 minute. Okay. Okay. So this is Lifestyle Champions International. And in LCI, as we fondly call ourselves, we choose life. We look for opportunities to make healthy lifestyle choices, everyday choices that relate to our well-being, so that we can improve our health-related quality of life, and so that we can reduce our risk of developing lifestyle-related illnesses. And according to WHO, when we talk about healthy living, it refers to a lifestyle that reduces our risk of developing these lifestyle-related diseases and prevents us from dying prematurely. So I'm sure that many of us who have been following us on LCI have seen that we have kind of tried to stick to the basics, of healthy living. Your food choices, meal choices, what to drink, your sleep, your relationships, how you handle your emotions. All of these are very, very pertinent. When we're talking about healthy living. Very special with us, and she's a very good friend and colleague. Her name is Dr. Tolulope Alugo, and I'm introducing her right away, and we're going to be asking her a few questions. Remember, we said that this is a panel, so we'll.
You're muted.
Yes, so our speaker for tonight, the person who is on the panel, on the hot seat, is Dr. Tolulope Alugo. She's my friend and a dear colleague. We're in medical school at about the same time, even though she finished way ahead of me. She's a child and adolescent psychiatrist with subspecialty training and qualifications in adults, as well as child and adolescent psychiatry. She's a fellow of the Royal College of Physicians of Canada, and she also holds specialist qualifications in her field from the United Kingdom and Republic of Ireland. Her practice is currently based in Canada. She's passionate about youth mental health with focus on prevention, early intervention, and access to optimal care. And that's what we always talk about in LCI. We talk about prevention. You don't want to wait for the big bang before you make the right choice. Dr. Alugo always takes a global view of ensuring that the health of parents and caregivers is given priority, and that they receive every support to enable them to parent positively. So I'm giving to you, Dr. Tolulope Alugo. You're welcome, ma'am.
Thank you very much, Dr. Makinde. It's really great to be here. I'm very appreciative of this opportunity. Thank you very much. And good evening, everybody. Great to see everybody and to meet you all virtually.
Thank you so much. Thank you for honoring our invitation. And we're going to jump right on to the questions that we have for today. So thank you so much, Dr. Fagbemi. Thank you, Ma, for being here. She's a mentor as well from the Society of Lifestyle Medicine of Nigeria. Thank you so much, Ma. Mrs. Tinubu, thank you for being here, Ma. Oh, my dear friend, Abimbola Oki from Gibson in Canada as well. Thank you for being here. You're highly welcome. So we're going to be asking our panelists, our guests, some questions. And so, Dr. Alugo, the first question I have, or that we have for you is, what are eating disorders? We're talking today about healthy eating, but the offshoots, is eating disorders. In the past 1 year, we've had some other panel discussions. There was a time we talked about whole food. Earlier this year, we talked about whole food. We tried to look at the differences between whole food and processed food and how we can choose whole food mostly, over and above processed food. But today we want to talk about eating disorders because we think that this in a way can prevent us from making healthy choices when it comes to meals. So what exactly are eating disorders?
So eating disorders are the complex set of mental health disorders in which individuals become overly preoccupied by their weight and their shape. They may feel that they're overweight when everybody else feels they're underweight. And this preoccupation begins to manifest in maladaptive behaviors, regarding how they make their meal choices or how they manage their weight, and ultimately can affect their physical health. And the commonest ones would be things like anorexia nervosa, bulimia nervosa, eating disorder. But the underlying theme is that maladaptive relationship between how they perceive their weight and their shape and their food intake.
Wow. Okay. So the common ones, anorexia nervosa. Okay. So how common is it? Especially within the population. Nigerian population. Do we have any figures in Nigeria? compared to what it's like where you practice in Canada? Are the rates really high, or we just come across them once in a while?
I can't really comment on the Nigerian figures right now because I haven't really researched into the situation in Nigeria. But it's thought that in Canada, in young women between the ages of 15 to 24 years old, the prevalence is about 1.5%. So you'd hear figures ranging from between 0.5 to 3%, depending on each disorder. But the commonest age of onset is in the 14 to 18 year age group. And we have seen kids as young as 10 and people as old as 23, 24 who are having an eating disorder. However, it's unusual for you to see it just starting for the first time after the age of 25. So in terms of how common, I would say about 0.5 to 1% of the population of young women, because it's commoner in females, in the 15 to 24 year age group would be my estimate. How common it is in Nigeria, I would say right now with westernization, with social media, with the drive to be thin and all kinds of access to the internet, I would say it's a lot more commoner than when we were in medical school. I don't think I saw one in medical school, but I would say it's a lot more commoner now than it used to be.
Well, that's quite interesting. And yes, just like you said, a lot of people, are, wanting to go a bit slimmer than they are. I remember seeing young ladies in my clinic who say they want to lose weight, and they are all about how people see me, how I look. So they feel it's a stigma kind of, to be overweight. And that could actually, I guess, could push some people to developing such a disorder. So who is more likely to develop an eating disorder? I think that still goes along with what we're saying. Is there anyone who has some peculiarities, maybe because of their background, parenting, and the way they are viewed when growing up, that can affect and maybe predispose these women or anyone else to developing an eating disorder?
Well, the risk factors for eating disorders, they are multifactorial. So in mental health or psychiatry, we like to say we take a biopsychosocial approach. That's just a complicated way of saying we look at the medical or the genetic components of a person. We also look at the way of thinking, which is their psychological aspect, and then the social aspect is the environmental aspect. So for somebody who has a family history of an eating disorder, that already raises the risk. Female gender raises the risk. People who were previously overweight are more at risk. Then when it comes to the psychological risk factors, people who are perfectionistic, who are obsessional, who may be anxious, or who come from a family where they're very overly protective and find it difficult to, individuate or face conflict. Also, any upsetting, so environmental factors like any upsetting life events, like breakdown of the family, parents going through a separation, for example, being bullied, moving countries, any kind of stress. It's generally thought that most young people who develop an eating disorder do so because life around them is so chaotic and this is the only thing they can control. So even with COVID, we've seen an uptick in numbers just because everything is topsy-turvy, but this is the one thing that they have control over, that they have a say over. So commonly, so female gender, people who have, traumatic home environments, challenging situations, and then their own personality types. Those would be the common risk factors.
That's quite interesting. A wide variety of issues then. Okay. You had mentioned earlier that young ladies between the ages of 15 and 24 years seem to have higher numbers, they're presenting to the clinic with these disorders. So would you say that it's more of an adolescent thing, rather than an adult thing. That if any adult has this problem, we can safely, almost conclude that it started maybe during the adolescent years or childhood.
Well, yes, it's most commonly starts in the adolescent years, and then it may persist depending on whether people get early intervention or get treatment. But it's rare for you to see it starting for the very first time after 25. So most adults that you'd see would tell you they've had challenges with their weight or their shape right from their early teens, and some may have been successful in hiding it, and it just is lingered, or maybe got treatment, got better, and then relapsed again. So it commonly starts in the younger years.
Okay. All right. Another question I have here. Are there different types of eating disorders? I know you mentioned 2, but is there any more to add to that? Any other classifications we need to be aware of?
So I mean, the common ones that we'll talk about will be the anorexia nervosa, which is where they have a pattern of dietary restriction, skipping meals, cutting out food types, with reduction in their weight, and you may have other, physical side effects. Their periods may stop. Then there's bulimia nervosa, where they go through episodes of, binge eating large amounts of food in a short period of time, and then making themselves either sick or using other compensatory methods to lose weight, like in laxatives or diuretics. And then there's also the binge eating disorder, where it's just they have episodes of eating large amounts of food, but then they don't have the compensatory behaviors. There are some other unusual ones, like the avoidance restrictive food intake disorder, which is like you might have a child who is picky for a particular reason, doesn't like a particular texture or particular foods, but they are not as preoccupied about how they look. It's not about how they look, it's more about just in preference with food or particular aversions to food that you may see.
Can I interrupt you there a bit? Because that sounds familiar. We seem to have a number of children who don't like certain things. For example, I know a child that will not want to eat meat, will not want to eat, can eat meat, but only a certain type of meat. Doesn't eat fish, doesn't like chicken. It has to be only meat. But like you said, I wouldn't say he's really preoccupied with his weight or anything, but he just doesn't like any other thing aside from the type of meat. Have you found out that could pose a challenge, maybe to the health or the mental health of a child?
Well, for that particular child who only wants meat, but if he's still functioning well, he's going to school, he's not moody, he's not appearing like he has other mental health disorders, he's not physically compromised, and I won't be too worried. I'll just say he's a fussy eater. But I've seen a few kids who, because of their aversion to particular foods, end up in hospital. Those are the ones that I become concerned about, where they would decide, oh, I'm just not going to eat anything solid. I'm only going to drink ice cream, or I'm only going to drink milk. And this is like maybe a 10-year-old. For some, I've seen kids who maybe they had a fear of choking, would then not eat any solids and end up in hospital being tube fed. That is the extreme end. But if it's just like fussy eating, I think with age and maturity, usually people overcome that, and everybody goes through that at one point or the other. So we don't want to label everybody as having an eating disorder.
Definitely not. Okay. But it's important that we try and guide our children, so that they don't stay within that aversion area, or a situation where they are adverse to things that are healthy, compared to things that are unhealthy. Sure. So I guess parents have a bit of work to do sometimes, in those areas, because children don't feel too good when you don't give them all the ice cream and all the sweets. And at the end of the day, that is, adverse for them.
Yes, balance is important in every situation. We have to be balanced.
Okay. All right. So is there anything one can do really to prevent an eating disorder? it doesn't seem so common, but is there any way that we can prevent it so that it doesn't show up in any of our children or adolescents?
Yeah, so there are a couple of things that we always advocate. So, I mean, so prevention in adults ourselves and prevention in our kids. Number one is to encourage healthy eating. So like we've just spoken about this young person that doesn't like some meats. You want to encourage everybody to eat 3 main meals a day and 3 nutritious snacks as much as possible, particularly a growing child. You want to encourage people to eat all the food groups. So not cutting out, carbohydrates, you don't want to allow your teenager to start saying, I don't want full fat milk, or I won't have butter, or I won't have this particular fruit because it's fattening. You want to normalize eating so that they eat all food groups in moderation. They eat regular meals. You also want to discourage people going through long periods of not eating, like long gaps between meals, because then what happens is people are so hungry, they then overeat, and that becomes a habit of dietary restriction, then binging because they're so hungry. So as families, we try to encourage families to eat a couple of meals together. I know with everybody being busy, it's difficult to sit down and have a meal, but ever so often, as much as you can, if you sit down with your kids, you see what choices they're making, you see what kind of portion sizes they're choosing, you see whether they're avoiding having the meat or the fish, and things like that. That's one. Encourage exercise. Healthy exercise will make it fun, because in eating disorders, exercising as a chore, but you want exercise to be something that they do for fun and they associate with just regular life, not like something that has to be because I want to lose weight. That's another thing. I just have a couple of notes here. I want to make sure I'm not leaving anything else when it comes to prevention. Then also, you want to also keep an eye on who your kids are associating with. There are a number of websites that are propagating, eating disorder behavior. They're teaching kids how to lose weight, strategies to get rid of food, to stay thin, and all of that. So you want to be sure what's your teenage daughter or son, who are they following on social media, what websites are they on, what are they, and then as parents also, we also have to lead by example. So a number of the eating disorder I see, when they come to see us and you're trying to tell the parents, okay, you need your child to go back to normal eating, you may find that even the mothers themselves have an eating disorder. So they're saying, you expect my child to eat all this food? You're saying this is normal, this is what they should be eating. Or they're saying, I don't have full fat milk. Why should my child have full fat milk? I don't eat butter. Why should she eat butter? So parents need to lead by example. Yes, we should be mindful of what we're eating, but not to the point where it now influences our kids negatively. So those would be my own advice for preventing or tackling an eating disorder quite early.
I think those are quite important points, because a lot of things come up social media these days. I remember that during the lockdown, the number of people who were on social media, went up by a ton, and there were the different sites that were being assessed. And so being able to control what your children are consuming is quite important. Of course, if a child is feeling intimidated because everyone else around them, has a particular physique, and they feel that that is the way out to reduce their meals and, skip some, then at the end of the day, it won't do much good for that child. Okay, so I think the other question that I have is, if someone has an eating disorder, how how can we identify it really, and quickly assess care so that it doesn't become, a problem?
So I guess first and foremost, if a parent observes that their child is restricting their diet, they're avoiding, meals, they're skipping meals, they're not coming to sit at the table for breakfast, they won't have supper with the family, they notice that their clothes are becoming so baggy, or they're wearing baggy clothes to even just prevent people from noticing how skinny they've become, then it's time to begin to pay close attention to that child. The extreme end will be when they begin to have physical consequences. So if they notice that their child is lightheaded when they get up from a sitting or a lying position. They're dizzy all the time. They have difficulty going up the stairs. They're complaining that maybe they feel lightheaded or they're having palpitations. Any kind of, or their periods are not regular. If they were previously regular, it's time to seek help. If mealtime becomes a war zone, I mean, I've got parents who will sit with their child and they're saying, you have to eat, and the child is saying, I won't eat that food. And they're sitting there for hours and it's such a stressful time, then you really do need to reach out for help at such times. But I think it's a matter of people opening their eyes and really observing what is happening around them and with their family members.
Yeah, I think that balance is key. That balance is key because like someone told me today, was it today or yesterday, a patient, a young lady, she's actually in medical school. She told me that she doesn't like eating, even though she's also coming out of a depressive disorder. But I think many times when there are issues with meals, appetite, it might be that there's an underlying factor somewhere. So like you said, yes, that should be a pointer. We shouldn't just gloss over it and, feel that we must order the person around or eat and eat, but we should maybe pay a bit more attention to find out if there are any of these other symptoms, that you've mentioned, so that that person can access care on time. So people want to know, how do I even assess care? If I think there's a problem, who do I go to see first? Do I just go and see the doctor, or who exactly do I complain to if I think my child is not eating as he should, or I think I'm not even eating as well as I ought, and I want to, but I'm just finding it difficult to do so?
I think it's important to go and see your doctor, because then the doctor can take a good history to assess exactly what's causing this difficulty. So if somebody is depressed, they may have reduced appetite because of their depressive episode, in which case the treatment is to treat the depression. But more often than not, kids who may have an eating disorder may not start with depression. They may develop it because they're not eating. So they'll be denying any concerns, but then the parents should take them to a doctor who can evaluate and determine exactly what is going on. And so for your children, take them to a pediatrician or your family physician. Then from that point on, based on the assessment, they may involve other professionals to help out. So they may involve a dietitian to help with meal planning, with education about healthy eating. They may involve a psychotherapist or a psychologist to kind of look at the thought pattern behind why they're not eating. So I think the first one is to go and see your doctor and take it from there.
That's key. Going to see the doctor at the right time. And I know we have a lot of people who are willing to give health information, even though they're not licensed to. And
True.
So some people will come and tell you that, there are a lot of fads out there. Some people will say, I've been told not to take okra, in pregnancy because my child will be salivating. That's just a food fad, really. And so many other things. So, but if we have concerns about our children, about our own meals, we should see our physician, who would usually work in consonance with other members of the healthcare team, which includes the psychiatrist, the dietitian, and also the lifestyle medicine physician.
Okay.
So is mindful eating possible for someone with an eating disorder? We talk a lot about mindful eating, as a lifestyle champion, especially here in LCI. And it's more or less about our attitude towards our meal, being able to pay attention, focus, avoid distractions, and, pay attention to the cues that, our body is giving us, so that we don't overeat and we don't take what is not really healthy or beneficial. So is there any way we can ensure that this, is embraced by people who have eating disorders?
So the goal of recovery of a patient with an eating disorder is that they be able to eat mindfully. So mindful eating will be a feature of the fact that they've recovered. But while they're still experiencing an eating disorder, it will be very challenging, because one thing about eating disorder is that it takes over. It's just, they're out of control. They're constantly, I mean, people who are anorexic, for example, every meal they eat, they're worried about how this is adding to their weight. They feel like their tummy is bloated. They're so stressed about eating. They're anxious at meal times. For the bulimics, for every meal as they're eating, they're planning how they're going to get sick, how they're going to use laxatives. So they're not able to focus on the meal or to savor the meal. They're just, their mind is on what next, what next, what next. So the goal of getting better, a feature of them getting better, is that they can get to a point where they have a healthy relationship with food. So mindful eating will be the goal, but while they're still unwell, it will be a challenge. That would be my own my own expectation of that.
This is really quite enlightening, and I hope we're already warming up with questions. So I want to say welcome once again to people who are just joining us at the LCI panel tonight, or depending on which part of the world you're in. We have in the house with us tonight Dr. Tolulope Alugo. She's a child and adolescent psychiatrist, and she has a special interest, in preventing psychiatric disorders, in children as well as youth, and also she loves to promote interventions, early interventions, so that they can have a good health-related quality of life. So we've asked her several questions. She's talked about what eating disorders are and how they present and how we can prevent it, and how we can, as a family, do certain things, together to ensure that our children do not develop eating disorders. But I would like to welcome questions from everyone else right now. Thank you for being here. I have a comment. A direct message was just sent to me by one of our attendees, and she's saying, my daughter recently said she didn't want to eat chicken or meat because she's been learning in school about climate change and deforestation. Should I be worried about this? That's an interesting question. Do you want me to go over that again, or you got it?
I got it.
Okay.
Yeah, and I think similarly, I'm seeing many teenagers who are vegetarian for the same reason. They think it's awful how animals are slaughtered and all of that. But we know that a lot of these vegetarian diets, it's difficult for kids to get the recommended iron levels that they need for growth. And so usually when I see a kid who comes into hospital who is very compromised with an eating disorder, we don't allow them to make those vegetarian choices. We kind of say, go back to eating everything. But then you have to also find a middle ground. So when they are then weight restored, back to eating everything, we can then begin to enable them to swap out. But you need a dietitian on your side to help them to make the right equivalent choices. Many people are just restricting chicken, meat, but they're not replacing it with adequate substitutes, which are not easy to find. So unless you have a really good substitute that you can vouch that this, nutrient for nutrient will replace the beef or the chicken in that child's diet, I wouldn't be recommending that should be the case.
Yeah. Thank you for that. And this is especially important in children. Our building block is protein. So as we're growing, we need those building blocks, and you get them mostly from some animal protein. Of course, we're trying to also encourage people to take a plant protein. We might need larger amounts, when it comes to, plant protein. But of course, we have legumes as well for people that don't have allergies. And there are other ways in which one can, build iron levels by taking enough of vegetables on a regular basis. But really for children, meat is still an important aspect. However, in lifestyle medicine, we like to talk about minimal dairy. It doesn't mean no dairy at all. It's not a vegetarian diet. We just say minimal. So the right portions. In Nigeria here, some people, they feel that, oh, this is life when you have a big bowl of eba, and then you now have a big bowl of soup, and you have like 5 chunks of meat, and you balance well. And the interesting thing is that is given to the father of the house, but you now give teeny weeny pieces, to the children. And you know what Yoruba people say? They say that they give them those very tiny pieces of meat so that they won't go and steal meat. They don't want them to steal, whereas they should be getting the larger chunks, And we, as we age, of course, we don't metabolize some of these things as well. We should actually reduce our own portions and allow our children to get better portion sizes. So this is really, really important. So back to that question, climate change and deforestation, those are real issues. Someone told me just a few days ago, that was even yesterday, that her 3-year-old was telling her when it was raining very heavily that the ozone layer is gone. It's gone. So these are real issues, and our children are more and more aware. Some of the things we weren't exposed to as children, they know about it, so they will talk about it. So, but we just need to find a way of balancing and letting them know, educate them and let them know that this is very important for your growth, it's important for your bones, it's important for your blood. So what they hear from us too matters. So we shouldn't keep quiet. We have a comment and a question here from Jaye Olaleye. I just wonder if force-feeding children, when they are giving ogi or porridge-like meals sideways with cupped hands, is this a risk factor for children developing food aversion? Also, how common is it for children with food aversion to develop eating disorders in later life? Is that an issue?
Well, maybe I'll start first with the force feeding. I'm not sure. I think it should be a question for the pediatricians to see really how many kids that are force fed end up not wanting to eat as they grow older. I can't comment on how whether that becomes a persistent difficulty or not. I'm not sure. Also, so far, I haven't really seen it that kids who have a food aversion at a younger age are developing eating disorders in later life. I may see them still being fussy about food, but I think the thing about an eating disorder is that body image dissatisfaction. They don't like how they look, which is very different from, I don't like how this food tastes, so I don't like how this food feels in my mouth. So it's always important to make that differentiation. So so far, I'm not saying that people who are averse to particular foods have an eating disorder in later life that is affecting how they view themselves or their body image. I think they are two separate issues so far in my own experience anyway.
Thank you for that. Body image. Yeah, I was trying to type it. Body image dissatisfaction. So that is very, very salient, a very salient presentation for people that have eating disorders. It starts from how they view themselves, and what they look like. That's what usually stems in this issue, and maybe not necessarily food aversion or the way they were handled when they were younger. So I guess we might need to ask the pediatrician, just like you said. I've not had much information about that either. Okay, so we have a question here. My question concerns a minor, my little boy, 1 year and 2 months old. He does not want to eat anything except breast milk. 1 year and 2 years. Okay, it's unfortunate I'm still on my way from work. Otherwise, I would have allowed the mother to talk to you. What can we do to make him eat? Because he's looking really malnourished. You want to comment?
Again, that's a question for your family physician or pediatrician. But I mean, a year and 2 months, I mean, this kid has probably been breastfed for a long time, and now changing to anything new, they are going to fight it. But it's going to be a back and forth between that child. I remember my daughter now, who is now in university, she would not eat anything apart from breast milk. It took to win her was a problem. And then winning her, she wouldn't take any cereal. So it was a tug of war. But you have to just keep trying till you find something that child would take. And to be honest, the only thing she ever took was pap. And I had to be putting soya milk because she wouldn't take any cereals. I had boxes of cereals and everything, and she wouldn't try anything. So you have to keep trying and trying and trying till you find the one thing that works. And then that one thing, they may take it for another year till they're 3 years old. Now she eats everything, but as a younger child, it was a challenge. And we had to go back and forth between family physician, pediatrician, trying every strategy. So I think it's a matter of preference, and it's a matter of just the mother being persistent to see what that child would finally accept.
Yes, I agree with you totally on that. Persistence is important. Sometimes early introduction of some of these meals is also key, but it doesn't work for every child. But if you start to introduce something at about 6 months, you're introducing something in the adult diet, maybe something mashed or something blended, but it's not good to give too many things at the same time to that child. Otherwise, the child will just refuse everything. So one might want to just try one thing every week. So you just try a new thing every week. You try and see what the acceptance is like for a particular meal this week, and don't try several things and say, okay, you didn't take pap, let me blend rice, let me give egg. The child will just say no. So, but seeing the pediatrician is very important, especially if you're seeing signs of malnutrition in this child. Okay, Bolatito, your hand is still raised. Do you want to make any comments, or have we answered your question? Because I see that you asked a question earlier on. Have we answered your question?
Okay, sorry, Doc. Good evening, everyone. Good evening, Doc. I just wanted to make a few comments. For me personally, growing up, I've always been on the, as far as I remember, I have always been on the big side. First, it was that I had big bones. And then, as I grew older, I found myself on size 14. Starting work, I've always worn size 14. I moved to 16, 18. Well, so I danced in between the two. And over time, I've had to reduce eating. I've tried all sorts, done diets, and things like that, gone on various exercise, and diet modes. And sorry, I don't know if you heard me.
Yes, we can hear you.
Okay, thank you. So my take is, and then I have a young daughter who is growing up and she's beginning to complain. And when I look at her, I just see the same kind of, back to what I was saying, before I jump into my daughter's stuff. So I've always had to do exercises, control my diet. And right now I'm on 1 meal a day, as much as I can. I try to eat once a day, don't eat before 6 p.m., and all that. I'm in my mid-40s and my tummy is beginning to grow. And so I went to visit one of my bosses one day, and then she screams, "Oh, you're having mid-age belly, whatever, I don't know." So I the way it is when people begin to point out certain things on your body, you start to feel uncomfortable, and so of course I started my race of investigating, checking up what should be done. Oh, mid-age tummy fat and whatever, what have you. So now I have a young daughter who is growing up, and then one day she comes to me and says, "Oh, mommy, I'm getting fat. I want to lose weight." I look at this girl. I'm like, "What weight do you even have?" You know. And then she wants to now start controlling her eating, and I'm like, "Oh my gosh, what's happening?" You know, I don't want a daughter who is also very particular about her body, just, you know, the way how she looks. And you know, this younger generation, that seems to be more of they are quite conscious of what they eat, and in fact they're even abreast of ahead of us, rather, with a lot of information. They know the best exercise videos to watch. You know, she's got all sorts of things in her kitty. And I'm wondering, so how do we build up confidence levels, you know, so that, I mean, because I see it as something I've struggled with. And having a young daughter who is also now beginning to talk about her body and how, you know, trying to focus on how she looks, if she has a pouch on her tummy and things like that, is becoming for me, it's becoming worrisome for me, you know. So I'm wondering, how do we help to manage build up of confidence? Because I remember my mom used to tell me, "Oh, no, you're not fat, you're just fine. In fact, that's the way your daddy likes you to look. You know, in fact, you're looking well fed." Well, I don't know if that's going to work for this generation, because I don't know if you understand my line of thoughts. I just felt I should mention it and maybe get more clarifications. Thank you.
Okay.
Okay,
You want me
we
to
can go
understand?
ahead. Yes. You can.
Yeah. So you said a lot of things, and I think you said a lot of things that many mothers on this platform would generally be also kind of would that resonate with many mothers on this platform. So we know that kids in this generation have more information to social media. There's more drive to be skinny, to be thin. But you want to help your child to have a good self-esteem. So number one, you want to constantly give her positive affirmations. Let her know she's beautiful, she's smart, she's intelligent. You know, her self-worth is not just about how she looks, but also you also want your daughter to also be healthy. So helping her to make healthy choices without becoming so fixated on what she's eating, helping her to choose right, but not restricting, helping her to eat in moderation, exercising with you as a fun thing. So is it a family thing that you guys can go on a walk together? I don't know what age she is, but I wouldn't say, okay, put her in a gym at whatever young age. If she's like
She's not fat, though.
Exactly. So I mean, in which case, just
I think
normalize.
it's just the age. She's turning 15.
Okay.
So I don't know if it's the age as well, you know, becoming self-aware, wanting to, maybe you have slimmer friends in school and all of that.
So you
So
want
I
to
don't know.
build up her confidence so that even though look, there's a way she's made up genetically that she may not be as skinny as some of her friends, because look at those one's parents. Maybe those parents are much slimmer as well. So just encouraging her to know you're your own person. As long as you're a healthy weight range, you are fine, you're doing well in school, you're beautiful, you're smart, and then making sure that she's eating healthy, she's exercising normally. Like, which is why I said make exercise fun. Do stuff together as a family, so that it's not like I have to exercise to lose weight, but it's part of our activities as a family, if you're able to do that. So she moves away from that feeling of I'm not enough because I'm not as skinny as A or B or C. So so I think my own take will be to work on building up her confidence, building up that communication with yourself and her, so such that she's not listening to that chatter out there, and her self-worth is not linked to whether she's skinnier than her friend, or or looks as whatever, comparing herself to her peers. So building up her self-esteem, I think, is key here. That's the core. And then ensuring that you just keep your eyes open. Don't focus, ensure she's eating healthy, eating 3 meals, eating nutritious snacks, not avoiding particular food groups because she wants to lose weight. Because just to catch it early in case she begins to have those unhealthy habits around food, or even the exercising. Yeah, exercising moderate amounts, but if it becomes an all-encompassing thing where she's exercising for hours on end every day of the week, to the exclusion of everything else, and that is a problem. But if it's just like moderate exercise, it's fun. You can even say, well, let's do that video together and have a laugh over it. So it becomes a fun thing to do rather than a chore that must be done in a rigid manner. I don't know if that helps.
Yes,
I
great,
think
thanks.
I think I love what you've said, Tolu. I really love that because we need to find that balance. There was something that Bola Tito mentioned. She talked about having 1 meal a day. 1 meal a day, I don't think is ideal for anyone. And it wouldn't be good for her to learn that from you, because when we restrict ourselves to 1 meal a day, then at the end of the day, your body is more likely to even store more of what you have eaten. You're more likely to slow down your metabolism, when you restrict to 1 meal a day. But if you take small meals, you could even take those small meals up to 3-4 times a day, well spaced out, healthy choices, healthy snacks, especially for our children. But having just 1 meal a day is really not the best, except maybe you are on a fast, and maybe that's just going to be for a definite period, not something that is going to become, a way of life. So for you to get all the nutrients that your body really needs, for you to be strong and agile, for you to have your mental faculty going well, good concentration levels, which is especially important for children and adolescents and people who are always going up and down. It's important that you have breakfast, you have your lunch, and you have an early supper. Of course, if you're trying to work on your weight, you want to avoid meals, late meals. You want to avoid going to bed on a full tummy, so that you don't even develop indigestion and other issues. So those are some things to take note of. And then exercise can be fun. I exercise not because I want to lose weight, but because I know that there are so many other benefits, and at the end of the day, I found that it's just fun, something to enjoy. And sometimes I get the children out, oh, let's do this together. Sometimes even this balancing of a thing, like toe to heel thing, a balance exercise, you spread out your arms. It's fun, even though it does help you, in certain areas, of your life or your health. But it's important to make it fun, brisk walking, playing football, the games, and all of that. So I want to believe that that has helped a bit.
Yes, thanks, Doc.
You're welcome.
Thank you. Yeah.
We have a comment from Mrs. Ogunro. Thank you, ma'am. She's thanking you for the enlightenment session. Very inspiring and insightful. And really, I would love us to appreciate Dr. Alugo for taking her time tonight, to speak to us about eating disorders and how we could foster healthy eating among our children and adolescents, and even adults as well. Please, let's appreciate her. So just send something into the chat box, to appreciate her. And then if we have any last minute questions before we hit the hour, we've already hit the hour of 9 o'clock. So it's time to bow out, really. So Kemi is saying thank you. Dr. Adewoyin, thanks for being here. She's also saying thank you, Dr. Alugo.
Thank you all. Thank you very much. I've had a great time with you all. Thank you.
Yes. Okay. Mrs. Raji, Ebon, Mrs. Alawode, Bola Tito again. Mr. Boniface, thank you for your kind words. Dr. Ugunoike, thank you. Jaye, my colleague, and we're going to be listening to her in 2 weeks. She's going to be talking about preventing diabetes. Okay. And we'll be sharing that flyer soon. It's going to be a masterclass. And interestingly, the World Diabetes Day is coming up on the 14th of November. And when we make healthy food choices, it's one of the ways in which we can prevent diabetes. So we'll be hearing more about that later on in the month. So thank you. Philip Oluyemi, Fola, Abibat, Oluwakemi, Aramide. Thank you. We appreciate you all we are all lifestyle champions. We make healthy lifestyle choices a point, in our day. We try to champion our day, by making healthy choices. So thank you for being here. We want to say good night to everyone. Have a restorative sleep. Don't stay too much up on social media, but make sure that you get to bed on time and rest well. Thank you, Dr. Tolulope. Thank you, sir. So glad to have you here tonight. Okay. So Tolu, thank you.
Thank you very much. Thanks a million for having me. And I will surely be part of the next. I will be there to listen to Jai's talk in a couple of weeks.
Okay, that would be great. Okay, so good night, everyone.
Night.
Night, night. Thank you.
Bye.
Good night.